for tuning in. My name is Sima Sahar Zerhi. I'm the Premier's press secretary. Premier Akeeagok will start providing an overview of the COVID-19 situation in the territory. Minister Arreak Lightstone is going to speak and provide us with an update on what's happening with the HR situation at the government of Nunavut. And then Dr. Patterson will give us an update on the Omicron variant and let us know what's happening as we transition out of the holiday season. Then we're going to open for questions. One question, one follow-up to start. Thank you very much.
January 6, 2022. Tana sima sibulekti pipalia yulana mutitiraktinga. Tana sibulekti akhiaro khalimalaulu nubajana 19 nurabu mepidjutikillugu. Ammalo minister Arreak Lightstone khalima sitakku iqana yaqtulirinarmu Nunavut gavamakkunginni. Lutta Patterson khawsi khasitakku Omicron nubajana mitsaanut. Khanurlu niriugiarnermanga takhikarnaulawqtillugu apersoqattassittaqwi.
Ja, udlakun Nunavumiutan, pilonguartukulumme innakuluppun, Akeeagok taamun tikittakulumme katta, isumagi vasse, udlanguyo nalunerun nasivugun 244 nguyo nuvannerjualeen Nunavu iluane, taakkoa 12 nunaleen attuqtausumalertum, 48 nguvun arvianen, 1 qamanittuarmen, 1 Iqaluttuuttiarmen, 2 idluligaarjummen, 17 idlulinni, 72 tavvane Iqalunnen, 23 kingnarnen, 19 pannertuumen, 1 mittimatalimmen, 5 pikirtarjuarnen, 45 kangerlinermen, amma 10 sanerayamittum. Taakua qulaagukkan naluneerunnarssima lauqattaila sanikiluarmen atausermen neriugiyau qartum amma taakua tikiqarjuamen naluneersilaurilluta nuvannerjuarmu neriugiyaujum udlumimun tikillugu udla 8 ngullertun nuvannerjuaqarunnersimayun katilimaarnugu taakua 24 ngullertun tamanna nuvannerjuarpigialautillugu nuvannerjuaqarunnersimalertum udlanguyo nalunersigumnarsigivugun taana qanuittiumanga nuvannerjua maannauyo nalunertaugunnarsiyo Omicron nguninginni Nunavu iluan taana lutta Patterson nalunersikkannerniartum tusaumatittikkannerlune amma lutta Patterson nalunersikkannerniarivun qannu naaseeqattarnitta asitserpallianiarninganen qannu sivumun parnapallianiarnitta nalunersiniarlune uguarnarjuartuugalua nalunersigumnarsimmigatta taakkua 6 nguyun innakkuvi mi aaduaami embassy wasmiilertun nuvannerjuaqalertun tamanna sivullerpaame nuvannerjuaq taavungu embassy wasmuumman isersimalumma taana nuvannerjuaq pigialaursimaninganen uqarumavunga gavamautilluta tamanna tautorjuaqattigun amma qannu ikayorunnangi kaluamangata qimeqquinnarniagatta innakuluttinnum amma ilagiinginnum ilanginnum qannu ikayorunnangi kaluamangata qimeqquinnarniagatta isumagivavun nalligivavun innakuluvun taanna lutta Patterson nalunersilaumaila Nunavun matuyausimagiaqarsimaniarninga January 17 wasunniarninganum tamakkua iliniarviin amma matusimasimaniarninginni nalunersisimavugun amma taakkutuan iqqanaayaqaaqallattaarsimayun iqqanaayaqunnerniarninginni nalunersisimattiarpugun taana unikaalautilluga Minister Lightstone nalunersijuminiartu qannu parnautaqarpaliangi kaluamangata Nunavu government iqqanaayartingi pidjutigillugin nalunersigumnarivunga Minister Grass pinnasuarusiulaartu January 11 ngullerune tavvane idortuame tusaumatittigunnalarmimma neriuttiarpunga tavvaniilerune iliniartulerine umissaanu tusaartittikkannilaarpugun January 11 ngullerune sivulertiudlunga Tan gavamatoqaqqunun ikayurtau giaqarsimanittinni nalunersikun nalaurama December 31 ngutidligu piluanguartume uluruanartume qunatigu iqqanaiartivun uluruanartume qunatigu ila tussira qalauqatta taakkua uluruanartisikkutiin kiinarmun matuan amma asingin amma qawisartaukoutigigunnaartun nuvannertuaqan kaluamangata pidjutigillugin nalunerunnarsivugu taana department anneaqartailingi tullerijikkun tussiqarsimammata 250,000 300,000 mo kiinarmu matuanguneartum tamakkua pisungaruttigun nunalinnun haamalanginnun nassiutilaaqartigun taanna parnatauvatliasimayum niriukkaluarivugun taakkua qavisaqutigijaukoutigigunnartun nuvannertuaqangikkaluamangata taakkua nunalinnu nassiutigumaartavun udluin maannattiakuluulurtu aggerpatliajunnu tamakkua qavisaqutigijaukouturunnartu pidjutigillutigu qavimagatta qavisaqunnaarnittinni angummattigunnarnittinnu tungaviqatlataarsimamman qavimavugu taakkua nunalinnu nassiutijaugutu atuuteqarniarninginnum qavimaqasiutivugun taanna nalunailaorlugu pinasuarusiulaumayung illukissarnittinnun tamanna siarmarpalliarninga assualu attortauguteqarsimagattam tamanna illukissarnerpun ajartortuariarpallianginnaqattigun nalunangiinnarsimayu piluanguartu nuvannertuar tikisimalertilligu nunalittinnun tuarngujunun nalunairumagivunga tusaumaqattauti tiinnaqatta haamalakkun nunalilimaaninggaangajunun nalunattiarumavunga naalakatta ama tusarpatliagatta tusseraariauvatliasimajun qannu ikajorunangikkaluamangata haamalanu niriuttiappunga tusaumatittikkannerumaarpunga pinasuarusiulaartung qannu ikajukkannerunangikkaluamangatigun haamalaujun tamannattau tussera ila nalunersikkannerumagivunga pimmarertuanen pairiviin maannauluanguartu assualu atuuteqarninginni nalunarunnerpatliatuinnarsimamman tusserarpunga nillerumasimavungallu tamakkua mappertaugiaqaluarniarninginnun piluanguartunen iqqanaajareaqallattaartunun taakkua uluruannartailequllutigun nunalittinnitsun tamakkua iqqanaajartivun aanniasuuttiin luuttaan imarmen illuttinnun tittivatliaqattartuun nunalitta iluanittun tamakkua aulatittimmata nunalittinni assualu atuuteqartum qavimallutallu taqajum ikajortaugialuin taakkua pairiviqanginninginnun naluneertauvatliaqattarsimamma apoqutigijauvатliallunillu pijariatullattaama aqqaagugasanen iqqanaajartik vatliatikkatiguila uluruanartumi qunnatigu nunalivun taanna Minister Grass pairivinun uqaalaqattarsimalumma uqallaqateqarpatliasimamma maannauju qannu ikajukkannerunnangikkaluamangatigun mappequllutigu amma qannukkanne ikajortaugunnangikkaluamangata governmentigun taanna qimeqqupatlianiaqattigun taanna apoquti gijauqunginnatigugalua iqqanaajarunnartun iqqanaajariaqartun pairiviqanginnimmunni ajuruteqa patliasimaningin uluruanartumi qunnatigu pileriarivatliagattigu tamannam tamakkua nuvannertuan teimaatigialu takusimanginnatsigun maannamu nunavu iluane qaujumallutalluun taakkua nuvannertuamun inutuukainnariaqarsimayun ippinnernallattaarsimamma taattortausimayun isumamigun amma timiqutiminigun qaujumallattaaqatta taakkua apoquteqallatta ila uqumaittuumman tamanna uqumaillattaamman pidjutigillutigun iqqaitittigiaqumavunga nunavummiutanen nunavu kamatsiartu ikayuusi naasauteqamman uqaalajaugunnartiarlute qangatuinnatsia naluneerumaqataarakkit uqaalautingin 867-979-3333 akiqangittukkun 1-800-265-3333 teikkannikainnarlakka nunavun kamatsiartukkunnu ikayuusin uqaalautin 867-979-3333 amma akiqangittukun 1-800-265-3333 tamanna nunavumme seemmaquppaddiannatigun piyunna viqartuinna ullattaaratteila iqqaitittikkannerumavunga luuttaa Patterson tiliortoqutigiqattarsimayangit angiqarsimale nunavummiutain angiqarsimagunnartuum amma illumiuqatigingittanginni kateqateqartaililin tamakkua kapuurtaugunnartum kapuurtaulutin amma kiinarmit matuarsimagunnartum atuinnariaqarnittinni iqqaitittigiakkannerpunga amma qaavisartaujuqaqaaqarunna uqaalalutin qaavisartaugiaqarutin nuvannersuaqarasugigutiila qaavisartauvatliagunnarninginnu pigiaqummatta tamanna luuttaa Patterson piqujivungaarutingit malippadlianginnarlavun taanna sivunittinnam kajusivatlianitta katutseqatigittiarluta aniguutigunnattiarniaqattigu kisiani taakkuamalillutigum so quyannamen nunavummiutain udlakkun nunavummiun especially our elders that are listening this morning. Again, I want to wish everyone a Happy New Year. As of this morning, Nunavut has 244 positive cases of COVID-19. We have active cases in 12 communities, 48 in Arvean, 1 in Baker Lake, 1 in Cambridge Bay, 2 in Chesterfield Inland, 17 in Iqaluit, 72 here in Iqaluit, 23 in Kingain, 19 in Pannato, 1 in Pond Inlet, 5 in Qikiqtartsua, 45 in Rankin Inlet, and 10 in Sanaraya. In addition, there are and is still 1 presumptive case in Sanikilua. We also have a presumptive case in Whale Cove. There are 8 recoveries today for a total of 24 recoveries in this outbreak so far. We have received some data regarding the variant. To date, most of the identified cases are Omicron. Dr. Patterson will provide more information on this. As well, Dr. Patterson will also provide details on changes to Nunavut's COVID-19 case management and testing protocols. We have also received news that 6 Nunavut elders have tested positive for COVID-19 at Embassy West Senior Living in Ottawa. This is the first outbreak the facility has had in its resident population since the pandemic began. As a government, we are closely monitoring the situation and providing ongoing support to our elders and their families. Ishumagivavun, nadligivavun. As you know, Dr. Patterson has placed Nunavut under a lockdown until January 17. Schools will remain closed and only critically essential Government of Nunavut employees will be working in offices. Minister of Human Resources, Minister Lightstone, will provide more details on the plans for Government of Nunavut employees after my presentation here. And on Tuesday, January 11, Minister of Education, Pamela Gross, will provide an update on the plans for our schools. My team and I have been in touch with the federal government asking for assistance to bolster our healthcare resources. We have also submitted our requests for personal protective equipment and rapid antigen tests. The Department of Health has just procured 250,000 to 300,000 masks to our communities. They will be sending them directly to the hamlets when they arrive. We are also expecting a shipment of the rapid antigen tests in the next few days. We hope that the test will provide another tool for managing the outbreak in our communities. We know that overcrowding is contributing to the rapid spread of COVID-19 in our communities. And as such, our government will continue to advocate for housing for Nunavummiut. Our teams continue to be in constant communications with the hamlets. We are listening to your needs and doing our best to respond to your requests. I hope to have an update on new supports for hamlets next week. On another note, I want to make a special plea to Nunavut daycares. We need you more than ever before. I am asking that you reopen your doors to help our critical services operational. Our healthcare workers, store employees, water and waste management workers must go above and beyond to help our territory during this severe wave of COVID-19. Many of these critical services are now close to the breaking point. Staff are exhausted, balancing work as well as childcare, which is unsustainable for many. Minister Gross is working with the daycares to see what we could do to provide daycare facilities and staff incentives and supports to open their doors. I hope that we could find a solution to support our critical workers so they could do their job. We have never had this many cases of COVID-19 in our territory. Most of us know a few families who are grappling with the strain of isolation. Thank you for doing your part to keep Nunavut safe. Although essential, isolating could be a very difficult and lonely. If you are feeling anxious or overwhelmed, please call for help. You could contact the Nunavut Kamatsiatu helpline at 867-979-3333 or toll free at 1-800-265-3333. Again, the Nunavut Kamatsiatu helpline is 867-979-3333 or toll free at 1-800-265-3333. Please continue to do your part to keep Nunavut safe from Omicron. Stay home and avoid gatherings with anyone that does not live with you. Get vaccinated and encourage your loved ones to do the same. And get your booster shot when possible. Wear a mask and get tested and isolate if you have any COVID symptoms. We all need to keep adhering to Dr. Patterson's advice. Together, we can get through this. Be kind, be patient, and stay safe. Kuyan namin.
In the past few weeks, human resources staff have been working around the clock to address the Government of Nunavut's staffing needs during this COVID-19 outbreak. Our priority is to ensure a safe and healthy workplace for all of our staff in order to provide essential services to Nunavut. As a result of the current public health measures, the Government of Nunavut has transitioned to work-from-home protocol effective January 4th to 17th, 2022. All public servants, including essential service positions, are encouraged to work from home wherever possible. Please only go to your workplace if required. If you are required to be in the office, keep your numbers small and abide with public health measures. We want to make sure that all of our employees stay safe as they deliver services to Nunavut.
Pinasuaro sigalaw si Mayuni, kanayak tuliri kudik kanayak tingat so tekas mamata tay mangalima kanayak aswakto tinunavu government kungite kanayak tikara hamningin nuwa anak 19 sang mapaliati logo. Sirulik pauti pavuta ko at tanak tumita ilititaw gaya hamningin kanayak bimme kanayak tilimatin no tako apit saraw tikat siyangin nakulugin nunavu miyum. Tay may mata ko mana yoan na hamnang ituloy ng mamalit taw yalipid jutigil lugi Nunavut government kung itay mahasidyak sinalik tut ikanayak ngak nalutang ikakayamin ni January 4 17 2022. Government kunni kanayak tilimat ilagayaw lutik pimario unik pijik siraw tini kanayali tay may kanayak uyawang kami tay may gun natuarutik. Ikanayak bimminyo katalutik isani tay may tuwara kalakigay guting. Iqanayak bimmu alla bimmu ga khatwaruit khatshina khatarlusi malit serlugi lutako ana hanang itulerin mo malit tawgali naluna sisimagumagatta iqanayak tilimabut uluganak tumitay ligun nakullugit pijit siraw te khaktillugi no nabummiuna.
Government of Nunavut employees are encouraged to contact their supervisors to determine if they are critically essential and attendance is required at the workplace, or if they're essential and can work from home. The government of Nunavut has provided various supports to help employees with the transition to work from home. This includes laptops with internet access, remote access to work emails, video conferencing, access to shared network drives, and other software applications. The Department of Human Resources has also distributed updated guidelines and tips for working from home and instituted increased health and safety protocols for employees who are required to go to the workplace.
Pimmarium mangata balu ang kamine kanaya ng mangata. Nunavut government kung itajiging ito ni kayo takasimayo kanayak tiyang kamine kanaya ng nakulugit. Ukwa ilagi yaw lutik ay ko harisaw yakalaan natsagaw yut. Kaya kibik ko kung nauti malu kanaya bingin titikangin ni takugun nakulugit. Takiyaw tikulu kati makatigi katakong nakulugit. Ato inahatit sinagmuluta ko ato kuktaw simayo ni harisaw yakut. Asingin nilo harisaw yakko rutino. Ikanayak tulirikut tunyo kaisima meyunuta anik malitaw galin nek hanok ang ikasimalo ni kanayak ng mangata. Atuluktit sisimalo tilo ana hanang itulirin ng ulanak tumitay ng mulo malitaw galin ni kanayak tinik. Kanayak tino kanayak yakak tunyo alabingin ni.
The reopening of Government of Nunavut offices is subject to public health guidelines determined by the Chief Public Health Officer. Currently, Nunavut is in lockdown until January 17th. If continued closures take place, a new update will be provided. As the situation is rapidly evolving, we are unable to make a determination at this time. Understanding that holiday travel and newly imposed public health measures may have an impact on some of our public servants who have traveled outside of their community, the government of Nunavut will continue to support our public servants to utilize a special leave code for isolation. Employees are encouraged to speak with their supervisor on their specific situation. Lastly, I'd like to take this time to thank our partners at the Nunavut Employees Union, the Nunavut Teachers Association, and the Workers' Safety and Compensation Commission. Together, we have been working collaboratively for the health and safety of all of our public servants in response to the COVID public health measures. Thank you.
Matutaw kanila ni Nunavut government kung itataan na maligayahang ngataan na hamnang itulir ng mamalitaw huyaw si mayutat sumakit si mayangan na hamnang itulir yung mariw. Manayok Nunavut miki sulima matu si manyang ata January 17 munut. Taman matu si mayto inam na akat nutanik tu saktit sige akala katak na tugun. taman nasidjik paleangin nangat amalumaan na yung nalunaytaw nangin man. Tukisiyo ma luta ko hikakayas simayo tiki palea na elektut amalundutat at anahan ng itulirin ng mamalitaw kuyaw simayot at tuwin nakahang at ilangin ni gavamak kung inni kanayak tinutakwa ulak simayo nunamin ni. Nunabu gavamak kung ikayot siyangin ng nato gavamak kung ikanayak tingin ni. Takwa lo hikakahak kata ni taili kuyaw yu takwa imbik ko ngayon hikakod na utimik piyom naktitaw na ito. Ikanayak ti tayo mau kakatakakuyaw ang iyok kamin ni takwa tunik hanok akat sigun naksamanang mga mi kanayak ningin. Mano yung li kuyan na may kayo na kumayak katakwa katudji katigi katatabot. Nunabu mi kanayak tinut katudji katigingit. Amalo nunabu milin na atit siya katudji katigingit. Amalo ikanayak tunit at tanak tumitay litit sinang mo. Takwa naliw kumali kaji katimayingin. Katudji luta takwa pili katigit siya. Kaya kakata, kano'y tayo hulugit, ulukanak tumitay hulugin lugawa makot. Ikanayak tingi, pidyo tigil lugo, no badyo anak tulagan ng mga anahan ng itulagan ng mamalitaw gali. Ano kong ni?
I'd like to start off by verifying that yesterday we have confirmed that Omicron is the dominant variant of COVID-19 in the territory. And as has been seen in other jurisdictions, this variant spreads quite quickly. I know that everyone's concerned by the rapid rise of cases across the territory. The best way forward is for everyone to reduce non-essential social interactions to as few as possible, and if possible, move them outdoors. If you are in a public indoor space, you must wear a mask over your mouth and nose. We are getting reports that people are using take-home tests to clear themselves from isolation early. Using a negative test to leave isolation early increases the chance that you will spread COVID-19 to other people. Please complete isolation as directed by health staff.
Pigya ako tsaka kumayunga, nalo na sigumalunga, ipatsak, nalo na ito longat, na Omicron nguninganik, takwa, nubadyo anak 19, tak si mayut, nunabumi. Tayo mata ko si magata, singin nervit to si mabiyo yun na tami, na nubadyo anak, hilame alok, siya masakay katakto. Kaya magalwak to nga, kikulimay si mahalo, tsaka nga hilame alok, takwa, mesong palya si maninginik, nubadyo anak, tak si mayut, nunabumi. Tayo makaw na pangon na ato sibu mugia ko tsakarlota kikuli mata ko pimakayong itunik ino katigini katikata gunit sa atugit amalo silami nga katikata ko na hulugi kikuli imano pagaw yun isang na ato awit ko amato asimay na hatara hatu si khanisi sulus kingat silo tayo mamato asimat sa arlugin tu sa kata takwa tao ang kami ni kawi sa kutiyo yunik atuk tutik ani sa kay gaswa katakto ani tayo kuyaw yugalwan takwa no badyo nang tukangin na ko tao yu kawi sa kutit tayo mapivali ko tao gunangan sa ang maksivalya gunang nasining no badyo anak mik asit sinun tayo mga tiliyaw si magutsa ni tayo kuyaw gutsi malit siya kalakit to si.
Yesterday we announced changes to how we will manage COVID-19 testing. Moving forward, we will focus confirmatory testing on new communities, high-risk settings, and those who are hospitalized. For communities with outbreaks, we will be relying on symptomatic diagnosis for many situations. This means, for example, if you have COVID-19 symptoms and live in a home with someone who has active COVID-19, you may not be tested. Evidence shows that the Omicron variant has an almost 100% positivity rate in households across Nunavut. We are also urging Nunavummiut not to call or go to the health centers, hospital, or public health units for COVID-19 symptoms unless it is an emergency. If you have questions, please call the hotline at 1-888-975-8601. Please be patient. We recognize that the call volume is very high. and wait times at times have exceeded 1 hour.
Ipatsak naluna sila tugasid sak tao gutiyo yun kanok awla tao ni ang mga tasibunit sa tinino pa dyanak 19 ni kaya sa katang niyo ni ato. Dahil mga toko agahang ni ato kung naluna situin na hatalo ta kaya sa kuti minyo yunik nuta ano nunalin no siya magbiyo si mayuni ang malolo kaya anak tuminik sanod ang malo anya bimiyunit si mayunun. Nunalin ni siya magpalya biyo si mayuni takwa kano igutaham ningin no naluna sa katang ni ato amisunak sa yuni. Taman na to kilik surlo, nuwa juanak 19 ngoya to ni kano igut harubit. Ang ikaharubit lo, ang ikamiyo hatak harubit, nuwa juanak 19 limik, kawai saktaw to inakahangit tutit. Tayo mga kawai naksimamata na Omicron, nuwa juanak tok tayo mga 100% mik. Siyang basunguningin, ilumeyo hatigin, tamani nunabumi. Ayaw tuigari bugut Nunavut unik uka lahat hunagit ubalo ni upagut sa kata hunagit anabinut anabalunut ubalo public health units. Nuwadyo anak 19 pedyo tigil lugut tuwagang naktung ito akan. Apek ko takarubit tanaw nga situm uka labiyuyok 1-888-975-8601 mut uka lalutit. Utakit siya ito yung nakatarit siya kawai si magatami so alayo ka lakatang ata malutak ito yung nakaharabi kakalima ungatano.
As I mentioned in the last press update, self-testing kits will be available at gateway airports in the coming days. When these kits arrive, they will be offered to all travelers, allowing them to test themselves twice after returning to Nunavut. These kits may help reduce the spread, but only if Nunavummiut continue to follow other measures. Instructions on how to use the kits will be included and are available on the GM website at the COVID-19 resources page. Thank you.
Ukalaw kamaking ulang pami pipanliya jino tusaktit siya tiluta namin kawi sa kutiyo atuin na lalak tutabyo yuni hangatayo kubimi ulugalaw ni actually. Tako kawi sa kuti tikis malakata atuin na lalak tikipalya yulimanut imini kawi sa katarong nahulugi makwati nunabumbot utik simalak tilugit. Tako kawi sa kutiyo tako siya magtaylitit sigutiyo kadnerun nangata Kisani, Nunavut malit siya to akata asilimangin nik malit daw kuya si mayunik. Tako kanok atuk taw ga mga tailagiliw tiyaw si malaktot atuin na walaktot ilo Nunavut government kung itay kaya kiibing ata tukisigyag bingan ni tako nubat jo anak 19 to ka ngayon ni. Kuyan nami.
Kent Driscoll, APTN National News. Dr. Patterson, this morning when your department announced the reduction and redistribution of COVID testing, and one of the reasons given was that basically it frees up staff to do other vital things. I'm wondering if you could explain the gain here. By eliminating the testing and freeing up those staff, what is Nunavut getting out of it?
Kent Driscoll, APTN Kumnigluta Patterson Ulasa Takwa Pilirivitsin Tusaktit siya kaugat sita ko kauya sa katam niyo nakatang balya ni alang ngapidyo ta hasiwi kana yaktiya singin ni piyat sa hang ni kong inut taman na kano pidyo tingani tukisiyak tiksikay na kay.
It frees up lab staff to ensure that they're available for other diagnostics that are just as important. The same people who test blood for heart attacks and diabetes and other conditions, including tuberculosis, not blood, but do the test for it, are doing the COVID tests. And if the volume of COVID testing continued to increase as it has in the last 2 weeks, something had to give.
Ako asingin ni piyat sa hakalwag min mata ang sibiyo yun ni kawi sabin ni solo tamakwa ane agutilin ni kawi sa katangata awin nik solo masituhang ng mga kubalo mi gusto kakalwak to ni kubalo pubalo mga ta takwa sa inay kawi sa katangata no ba juang naktohang mga ta kawi sa kutinik Ako ami sulu alak ni kung inute mama ko pinasarusyo si mayute maasingin ni nukhatit si kay naksimagya kalilawata.
The other thing is, we have to flip our thinking a bit. A year and a half ago, there was a lot of discussion on false positives because there was no COVID in territory and we'd get these sporadic false positive results. Now, especially once we've confirmed that COVID is spreading in a community and actually in a house, if you have symptoms of COVID and you live with somebody who's already had a positive test, if you get a negative lab test, it's much more likely to be a false negative than it is to be that you have some other infection. So if we're already saying that we're going to treat those as false negatives, then there's the value in testing is greatly diminished.
Tanataw isamagiyaw hammin makano isamadjusi basit jara hagatiwa kaguata sakbaluna simalekto tamani no badjo nakto haktin nagono na bumita ko ilang itam makattalaw ngata kawi sakuti minio galwan manali no badjo anak 19 sa mapalyalang ni kung anong tako na ninunalin ni ang kami katigi nilo ilumi katikakawit tay mag no badjo anak tulim mi kawi saktaw galwa kawita ko tam makto minio pata Nuva John nakto hangin nakakta ulutit tay ma nalo na tao tuy na hangatama ko alo how yes ako tiyo yato ti hangin naksagom nang ngata tay ma kamak si makatta kalo aktilugid nalo nang iman sayang mapalya katak na ang ngata nuna ilumi ang katigin.
Dr. Patterson, to the best of your knowledge, has anyone been charged in the most recent outbreak for ignoring public health orders?
Uta Patterson takwa how you mayam kasi yat sangok to kalaus maba si kumitsi yuminong ni malitaw galin ni mano yung
Aga.
Teresa Khetchuk, CBC News. Hausi mazugo anya vimik kanaizakti amikaksi mamatamana hanutana atuini kaka Nunavut government Giu valianing ni siama paliazumo. We know health staff is in short supply right now. How is that affecting how the Nunavut government is responding to the outbreak?
In most communities, we've cut down services. In some, we've had to cut down. We've had to reduce services because of staff being isolating after exposure. And we're making we have contingency plans for supporting communities either by bringing more staff in when available, by expanding virtual support. There's a number of possible options we could use if this continues.
Nakatawag at sa mayo pa si rautit ilang ilo tayo mamikiliga tayo sa maluti tamakwe so ilang kanayat yan itay ko jaw si khatak mim mata tayo manu ba jo anak tulun ni katisi yumini ugay mata ta ko na liw kumani pam na utak sa maluta lo ikayuk kan ni ruti unak tunik so lo kanayat titatis si kan suta ubalo ni harisaw ya ko ikayuk su kan suta at jiging ito ni tayo ma ikayutinik ato na utik sigunak tugunun alin no.
Hatchini Nunavut piniak sukatuni hausi sautini government hakkunni. How many rapid tests will Nunavut receive from the federal government?
I don't know all the details. The best that I know is that we're, in addition to what we've already planned for and are expecting, there will be as many as 4 tests per resident arriving sometime in January.
How you mangito at ako ilulingin ni kisanit ako tusak si mayakot sita mahugunang na ato atunit Nunavut mo how you sa ko tigunak to 4 tests per person 4 tests per person sita mano so Nunavut mo at atunit tunot sita mayakot how you sa ko tigunak to.
Good morning, Dr. Patterson. Corey Larocque with Nunavut News. I was hoping you could elaborate a bit on hospitalizations. How many people are in hospital presently, and maybe how many have been in hospital since this current outbreak began in late December? And are they hospitalized here in Iqaluit or elsewhere?
Corey Larock, nunat sert news kunin alo na yayakon na kian na belon ni unit si mayuni hatsiw lang mga ata. Taman na lusama pala ni pigalaw mani December nung wani namilunit si mga ata tamaan ni Iqaluit ni asingin nilun ni na belon.
I'm aware of 6 right now. We were notified of 1 just before the presser, a new one. Up until today, it had been 5. People have been admitted in Iqaluit, Rankin Inlet, and in Winnipeg.
Kauye mayakut 6 ngulit tutako nit si mayan na belon ni ulla tao sitan na kauye tayo na kauye pigalaw nginitid ni talimaw hatalaw tutako na belon ni unit si mayut Iqaluit ni kangasen ang me Winnipeg Milo.
As a follow-up to that then, is there a number of cases that you're forecasting would be the true breaking point for hospitals where they're not able to take any more COVID patients in? Does it have to hit like 500 cases, 1,000 cases? What would really jam up the hospitals to take in new patients? Is there a forecast number?
Tana perigao tigi kanel luguta ko no vadjo na ta simayo ni riu gijao yo khatsiu le khata na belon ni ni khatala tu taima amigar silla lila khat 500 gole khata 1000 gole khata taima tamana to kisinak tiga kay na.
No, we don't have that number, in part because we're it depends a lot on, I'm going to correct that, it depends almost entirely on what's available in beds in our southern partners. And if they're full, then we look elsewhere as we typically do, even when there isn't a pandemic.
Aga khatsiu ningin ni khawi mangito go ta ko solo khanutigi illi na to ina yo hamanga khallunani khawi khara khara yagata taimalo ini khangi patasingin no khinira khara yagata ni tsima begun na kayak ni taimangin na suungot talasa maqalla yo khalawtin nago.
Trevor Wright, Nunavut News. Have you guys been able to, with the cases at Embassy West down south, have you guys been able to find a contractor? Has the contractor been able to find staff at the elders' home here?
Trevor Wright, Nunavut News kunik tako nuvan jana ta simayo Embassy West main na kubim mi halunani tamani like halunin na kubim mi khawi simalakisi contract arum naktumi matuak sigin naktumi.
My understanding is they're able to maintain service, and we have Department of Health has sent 1 staff down to assist and monitor the situation and keep us apprised of what's going on.
Tukisi mayakuta ko sule mangum matigun nat saktut anna hamnang tulari ko nuna mita nungaw lakti simayo to sa matitsig yu nakto me watinni.
I was referring to the Iqaluit elders' home. Has the contractor here been able to find and train staff, or?
Sorry, Trevor. Sorry, Uli.
Tamani khalun ni pidjuti ta ko contractor simayo khalikain na ko bimmi matuak siyo gur naktuni awlat sigur naktuni.
Yeah, koyan na metan Trevor apakutiava innakovivon tavanito anyahanna tulnitulrikon ministrangan tan apakote kiuyauti kumarakon so man nalunerun nangitwa kanweding at talmangan kisian tan autoviginyapagin. Right now I can provide you an update in terms of the elders facility here in terms of the renovation. So once we have an update, I'll make sure to bring that forward to you.
Okay. Let's see. With the New Year's being not too long ago, and there being some notable spreader events down south, has there been any similar cases, super spreader events during New Year's here in Nunavut?
Akeeagok tangulau tilugu tako tusang nakatangami si sa magbiw hatta tukati si matiluya mi si tay machay na Nunavut miami suni kati yuminom ni siang maktukalaw mga kauyi naksimaba.
We're aware of a number of get-togethers that have happened and led to some spread, but nothing that would qualify as a true super spreader event.
Tusaksima yugat jiging ito ni takwa kati katak tuminiyo yuni tay mga siang makpalya katigilik tuminiyo tiluwi kisa niami suni siang makatigit sima yuni tay matigi tusalaw ngitugun.
Emma Trancher, the Canadian Press. Given the fact that we might not know the exact number of positive cases in the territory with these new testing requirements, how will you make decisions going forward on certain public health restrictions and what the territory needs to do if we don't know how many people have COVID-19?
Emma Trancher, Canadian Press kunni tay mahawi madja gunni gata khani khatsilata no vadjanak taksima mga ta kanugli sumali ko tala ka bimalitaw gyalin ni kaya mangillo ta khatsiulat talang mga ta lalo na taw simayo.
We'll be tracking it as it moves from house to house.
Ay sa kanya nga jugo illo may khatigini at siging ito no illo may khatigino siyang mapalyaning.
So will that mean then that you are assuming everyone in that household has COVID and will count those numbers as people who have COVID-19?
Tay mata ko tukikakailo may khatigi numadjanak ta simayo nauning ni tay manasa kasiw jaw katalasibat.
We won't be able to officially count, like in the statistics that we're reporting, we won't be able to count those people diagnosed through symptomatic or syndromic diagnosis.
Syndrome? Okay. Lalo na sa katakon na jangit to ko nasaktaw ko na katajangit to kanu iguti katuin nak to kisa na kawya sa kutik ko lalo na taw sa mayon na sa katakon na kaya kakata.
But we can certainly use the growth or the increase in the number of households that are involved as a measure of how well controlled an outbreak is.
Kisa ni tako ami sukung palya ning illo may hatigi ni tayo mga kawi balyagon na katak na tabo kanu tigita man na wala taw siyang nakaroon ng mga siyang mapalyan.
Kent Driscoll, APTN National News. Minister Lightstone, please. Minister Lightstone, throughout this COVID crisis throughout the country, many workplaces have put in vaccine mandates where you have to be vaccinated to go to work or you have to go through enhanced testing in order to prove that you don't have it. Is there any thought of the government of Nunavut putting in vaccine mandates for GN employees?
Kent Driscoll, APTN kunnik Minister Lightstone takwa kapiyaw si magyakal lutik kisa ni tayo katak sa mamatay kanayak unang narutik. Balong ni haya saktaw si matsyato akata tay makapiyaw si magyaham ning inni sumasaksi ok hak sumabata makinga kanayak titsino. Oops.
Thank you for the question, Kent. I appreciate this being my first opportunity to respond to a question during these COVID pressers. Once again, that's a very great question. The Department of Health has mandated vaccination requirements for frontline healthcare professionals, which comes into effect January 10th. As this government is merely weeks old, we have yet to have that very important discussion, but that is an item that needs to be discussed at the cabinet table, and I hope that we will be having such discussions shortly. Thank you.
Kuya na may aparigon na kabi kaya na sibulak pa siya may kiulak to tayo mga tusaktaw titsa kata tilawin. Anahan nang ituliri ko tayo masago bahang ito may kapiyaw kaya kak na kayo si mayuta ko nung inunik kikutuin nang ni katisikat tunik pigala to January 10 May. Taman na pigala katakam ni ano sa mapalya New York taman na pimakiulo ni hausiyo kaya kak na to. Tako minister katigi katimayang itako ko sirilaktang itako kapiyaw si magyakalakin ng mga tek kanayakti.
Minister Lightstone, during the previous outbreaks, one of the biggest criticisms from GN staff has been how critical and non-critical employees are determined. It's being left up to individual supervisors. I'm wondering, is that going to be the approach of this government going forward, or are you looking at a different way to try and consider who's critical and who isn't, that isn't so dependent on lower level supervisors?
Minister Lightstone, taima sang mapalayo hakatatilugo. Takwa pimmari yun kanayali naluna tao katalaw nga tapimmari mga tao baluni pagyakang mga ta ang yokangin no naluna tao lutik manawlek tuloy gawa matakang otilos kano taman na naluna yak tao katanya kanaya kaya kalaki to nalyang na mga ta.
Thank you, Kent. That is another great question. As there are increased risks associated with the Omicron variant, the government of Nunavut would like to see less essential employees returning to the workplace during this closure. So the Department of Human Resources has directed deputy heads to be the decision makers who decide which employees are critically essential and are required to return to the workplace during this COVID closure. And once again, all employees are encouraged to get in contact with their supervisors to determine whether or not they are critically essential and required to work from the office, or essential and are required to work from home. Thank you.
Kaya nami kakaulo ka anak tumigo tao kan niralan ning ano taman no Omicron no wadyo anak nirak tao yok Nunavut government kung katsin no naksanik kanayak bingin no paguti katta ko iyo galwat takwe kanayak tuloy ko tili sisimayo minister itudlingin nik dalo na si khulugin naliyat pimmarin nik kanayali utira khalakay mangata kanaya tili malo ka jawgi ako ngayon kami no hawigi ako yaw lutik kanaya bimin no utira ka mangata.
I have a couple of questions from Juanita Taylor from CBC North. The first one is for Dr. Patterson. Have any communities had to medevac patients for COVID-related treatment? If so, how many and from where?
Makuapit kuti takwago Juanita Taylor, CBC Kumnik, Luta Patterson, Nunalin ni Ravang Naktuko Hamatayo Good, Outlatito Yohaya Haksumabano, Joanak Taksmayunik, Malohat Shivat.
There's at least three, one each from three different communities that I'm aware of.
Pingasusi Mayo, Pingasuni Nunalini. 3 communities or 3 regions?
3 communities.
Okay.
Did you want to state from where?
Sorry, where the numbers are so small, we won't be releasing that.
The next question is for the Premier. Has the federal government responded to Nunavut's government's request for assistance?
Request for what? Oh, government of Hakut, Kiula Kanuna, government Kungita, Tusira Tigis Mayangino.
Thank you. I just want to go back to Trevor's point in terms of the Elder Care Center before I respond to that. I was just made aware that the renovations for the elders facility here in Iqaluit are almost done. A contractor is in place and that they anticipate the opening of the elders facility this month. So that's great news. So I just wanted to connect back. In terms of the question, yes, the federal government has indicated that they've received a letter. Our senior officials right now are engaging with each other in terms of what that support could look like. I'm hoping in the next few days that we will able to provide more of a response in terms of what support is available from the federal government. But I can confirm that there's discussions taking place with our senior officials right now. Tako kanayativo government of Hakunu to Siraka what take a yota we are knitting. Man Nalunero Natigon Titaka Nasir December 31 Mulutigo Pijausimaloto. Matako Minister Tino Tuatila what take on Iqaluit Maria Hasimanita Kimiko Yauloto. Iqanayativo mana Kimiko Hatautiluk Naukon Amakisui Niriwigum Nankalo Mangatigon. Tana to Satitigo Manapunga Udlu Agapadleon Nauko Iqaluit Nankalo Mangatam.
This is a follow-up. I suspect you've already answered this question, Premier, but have any nurses been brought in by the federal government? And if so, how many and where have they been sent to?
Ana seotini government of Hakuninga to Netikita yo Hasimaba Hatsio Valo and Balonamo.
Aka mana tikititisimangitigun kisiani tussirata iluani matamana ane surti kisianita kisiani mana yo nalunero nangitinga tikititisimangkalwa mangata. The question in terms of whether we brought in obviously is a part of the discussion we're having directly with the federal government in terms of the supports that have been identified by the Department of Health. So we're monitoring that very closely, but right now, no, we haven't received any extra nurses that I'm aware of. Timon.
I have a question from Donnie Alec from Akeeagok Radio. It's in regards to the delay in confirming tests in the Kitikmeot region. She just wants to know if we can outline how the testing works in the Kitikmeot and why there's such a delay.
So all communities have the ID Now devices and can test in the community, but as we've seen, that's been considered presumptive only. Confirmatory swabs are flown to Rankin Inlet and Iqaluit, and as many communities have seen over the Christmas holidays with changes in schedules and weather, providing confirmatory results has been delayed. In order to improve things and be able to provide confirmatory results in a more timely fashion, we're bringing back the process of having a plane on standby for charters if flights are going to be delayed more than 72 hours.
Teresa, Hechuk CBC News. Amisu matanuna vomilo hangitui sinitahatak tuya jiging itu tinilune hanokle nunavo government attachmenga piliri ni halangava dako at anak tumini ang imata baluni siya magyaktichin ang imata kikutuinakno. Many homeless people couch serve. What are you doing to provide a safe place for these vulnerable people so they stay safe and don't spread the virus?
Oh, sorry. When we've become aware that somebody's been exposed or diagnosed and has does not have secure housing. We work with Nunavut Housing Corporation and others to find them temporary places where they can safely isolate.
Tema hauiga igatta katiyaminu yo haktu hartillugu nuva joanartulit neupaluni nalunaartau yo hartuminutilugu nuva joanartu harninginnik taakkunugangi qaqangittunut piliri qatauqattartu Nunavut milluleriirtuakkut assingillu taakkua attanang ulurianangittumi inihakainnahattarunnaqullugi seammartailititsi qataugunnaqullugi.
Nunavut gavamanga khano atuin nautichilangava nikhini takwa nunasiuti khangitui aichirsigunangitui what are you doing to make food available to people who need it the most, who don't have vehicles to pick up hampers?
Koya namin Teresa tana pa kotitia valu ulumi mutikitsugo nikhini piluang watone angi kasima koyo yunun Iqaluit takwata pekativu katujahatigitia tutigo Nunavut tungaviko amma uko avitosima yuinu katujahatiги ngitau nikhini tungavi iyaudutu Iqaluitini sakkisima mimata gavamauduta tana uperitia megatigo Iqaluinnare hartavu Nunavut miutan nalunerunnatunga maannamo 300,000 ungatana atossimalottigun nikhini Nunavut miutanu angiqarsimaquyoyunun toqaangayunun taannalu sivummun nalunangittu kayusinnarniarninga taakkua governmentluta tiliortoqutigiyauyunit lutta Patterson mo taanna seermaquyaunginninga tungaviqarman Iqaluinnalimaarnattinni Iqaluinnarniaqatta. So thank you for the question, Teresa. As a government, obviously the food hamper program we do provide has been very essential in terms of the appreciation. Nunavut see to date, I could confirm we've provided over $300,000 worth of hampers to Nunavut, and that's something obviously as a government will monitor and continue, especially with the cases that are mounting in terms of the numbers of positive cases. Very much look forward to continuing that particular program as we move forward.
Thank you.
Premier Corey LaRock with Nunavut News again. I was hoping you might elaborate on the assistance you've requested from the federal government. In southern provinces and some other jurisdictions have asked for military assistance in various capacities. Is that something that you have put on the table with as a request for the federal government, something you would consider? A role for the military?
Oops, sorry. Corey Laurent, tema tutsarasimagatsigava matohakkumnik hallunani lite koilangi tutsarasimamatau nalitsayakkumnik tema tsaina teimagala tutsarasimagivissi unalitsayanu Iqaluittaugumallusi.
Thank you, Corey, for the question. No, the military is not an option we're exploring right now. The support we are wanting to provide is obviously in consult with the Minister of Health in terms of very key specific healthcare professionals and personal protection, but military is not something that's on the table right now. Obviously, with the evolving situation, there's those tools that are always there. But right now, we very much look forward to working with our colleagues down in Ottawa in terms of finding supports where we need it right now, as outlined by Dr. Patterson and Minister Main, as we move forward. Tana apakutitia valu kori manau yo tusiragasi majavotle amigasi manitta uluwana tumekhunatigo nunalitin military kisiwa yappa ha unalisa ye tusiragasi mangittavun taakua tusiragasi majavotle amigarotigisi majattinnun taakua luuttaan ania suuttiin piluanguarutigi yauyun qawisartortuan kisiani sivunittinni taanna nuvannerjua saimmarpallianinga tautullutigo kisulumaqimiqquinnarniaqattigu Iqaluinnartalimaattigu Iqaluinnarniaqatta maannauju kisiani taanna qimeqqusimangittiartavun.
Thank you. And then just as a quick follow-up, you've mentioned housing as one of the supports that you would like to see from the federal government. Is that a long-term solution? Because housing, of course, is an ongoing issue. Is there a short-term support that Ottawa can provide that's COVID-related in the current circumstances, in the current situation?
Kayo gawita ko ilulere na tayo mga tutsara uti kasi uti simat sugu gabang ato hakunik tan aku ni uji mo nalunang ito aku ni ugayang atay na liman na kay na hilami yung nasakot tamatu mo kayok tayo gumas na mabigabang ato hakun no badyo anak pedyo tigil lugo.
Ja, tan nuvan nudwa sakir dwa sumamay da idlu kisartin ulugan atumigutti kasi uti sinasimatyaman uttu takalawa mapinaso ako si ulortume pannote uttu tigilego nuvan nudwa katapo amma puwadlun mo sai maksimaninga nunalingan tava ulugan atumigdwa utitta ipinnonna dattasimaman nuna voluma mutan idlu kisanna amigarsimanitinnon ipinnonnasimayo attoktausima nuna vomiutain amision adjiging itutigon isumalut isumamigon timimigon takwa pidjutigidegen takkiuqataalortu aduamo katakataqarunalawama sivulutteme Prime Minister Trudeau taanna idlukissarne saqqi sivullu lattaangumman apoqutigisimajavumannamo Prime Minister uqallaqatigittialortara taanna neriwittiartara katutjaqatigigumaniarnerniivanga taanna piluangualuttu nuvannerjuar saimmoqqallialurtillegu nunavumme qana uluruanartumiitittininga ippinnernarsикканнэрман taanna pidjutigillegu minister tiin uqallaqatigi qattarsimalilaumajavu taissumane aduaamiilluta amisun ilisaqittiartui taanna pimmariuningana illukissarnitta amma qanortuuqataqarumaninginne ippinernaltialortu uqauseqaqattalorlutillu neriunartu taanna pilerinnarniaqattigu illukissarnerpun piluangualertu qainuvannerjuar tavvaniilertillegu tuaviarigiaqernittinni assuruarikkanneriaqerniarnittinni ippinnernallattaallermailaam. So I just last month I had the opportunity to, before the COVID came to Nunavut, met with the Prime Minister specifically in terms of the mandate that we've established, and housing is a top priority of this government. It's, I think, has been exemplified in terms of the shortage that we've seen. As noted just last week with the experiences that we are seeing in Panuktu, we're seeing the pandemic of COVID hitting the community on top of the tuberculosis that they're dealing with right now. So it has exemplified the urgency for true action, and it's felt right across the territory. Obviously, the shortage of housing has been a file that has been noted many times, but I believe it's more prevalent and more evident on the urgency for us to act now than ever before as we're fighting a pandemic in unprecedented times that we've seen so far. So the short answer is yes, housing is something we have to find a short-term solution for, and that's something I will continue to lobby the federal government specifically on finding creative ways to address the housing shortage that we do see. So with that, I very much look forward to continuing our discussions with Ottawa, both on the short term, and the medium and the long term fight. I think we know right now there's 3,500 units that are needed right across the territory at the expense of $2 billion. So those are numbers that have been already outlined before. So with that in mind, I very much look forward to working with the federal government. So
Okay, Trevor Wright, Nunavut News. As we're entering our second year of this outbreak with more lockdowns, more vaccines and all that, do you have any words for people who are feeling extra fatigued at this point in going into the second year?
Trevor Wright, Nunavut News kunni tullana qaagumani liqattasaamma qallani matumayawleq sutalutu saqattaqqiita makkunu takhasimayuni.
Taana apequtittiavalu ippigittiarmiakka takhayun nunavumiutain taana aqqaagun maqqu ungataaniillerma nuvannerjuar nunavuiluane saqqi ila kamagi vadlia lau simagatigo ipin natiasima Nunavut tai takasimayum kisian ukakan na kumatuin na pungatan luta Patterson malakuyangin malinakayakakatigo uluwan na tumikon natigo Nunalivon piluang watum innakulupon takwa mannaw yung takanakalwatigo maligayakakatigo uluwan na tumikon natigo piluang watum innakulupon so tanale takayun na walwatigo kisian malinakayakam nupon amma nuta taman atok simangin natigo anigong ngama yunguna upperit yataga malitiangin nagotigo takwa malako yaulo simayon luta Patterson mo anigo tiyana tavupo aswalo uppigo sunno mo tikitaw simagama kanotige Nunavut mute sangim mangata kanoktogon na sungungin tako simalagatigon ilisarigo matiarakin asogod latasimayo manamun lutan anesiutin angunasutin Nunalimene payuqattartuisule tamakkua assuala upikusunnammu tikitaunamman qanuqtuurunnarnittinnu so taanna pidjutigittigu malequ yausimayu malipalliaginnaruttigu qilamiunnersa anigutigunnarniaqattigu tamanna. I couldn't agree more in terms of we hear many Nunavut that are fatigued. We've been under this pandemic right across this country for over 2 years now. But I couldn't stress the importance of continuing to adhere to Dr. Patterson's orders for us to get over the pandemic much sooner and in much better shape. I am instilled with so much pride with how resourceful Nunavut are in terms of their ability to go above and beyond. And it goes right across this territory from the frontline workers that we do see with the nurses and the doctors and the contact tracers, but also the harvesters that have been feeding the communities right across. So it really gives me that sense of pride seeing it, although I do share the fatigue. But for us to overcome this, we must continue to follow Dr. Patterson's orders, just to stay home, avoid gatherings, get vaccinated, wear the mask, and get tested if you have symptoms. So we got to continue to follow the rules as laid out by Dr. Patterson. So
second questions for Dr. Patterson.
Emma Tranter, the Canadian Press. As we're seeing cases rise in the territory and we're seeing a wider spread, what do you attribute these new cases to? Is it travel or is it community spread?
Ama Tranter Canadian Press kunita man nasa mapalya news simayo pidjutigillugo kisumi pidjutikalo asu review awla khatalaw tunut ubbalo nunalin nisa mapalya nama.
All three. Sorry, I'm not trying to be facetious. We're tracking multiple introductions into many communities, and then spread in the household and spread between households, and sometimes in some communities there's more than enough COVID that we're having people being diagnosed with COVID and we don't know how they were exposed.
Iluna tita ko pinga sukatitugi tan na pidjutila pijaring itu galo kisani ami suta mako sa mabyo khatak simayo adjige ngittu ko pilo to me illu me khatige ngita menu pula khattaw te khattana mo taman na sa mapalla news manapa ta ko ilang inaluna taw simangitu galo kisani naluna taw simayo ta ko khawi simaya butay mati gisa mapalla simaningin ni ta ko iluna te pinga sumalittugi.
Chair, Nunavut News. There's been some talk about cases coming up from down south where obviously more cases are present, but has there been any introduction events where related to inter-community travel?
Travel right Nunavut News kung nita ko how yung magatahallo na ni nga to ni sa mabius si maningin nut kanul kaya tamani Nunavut mesingin nunalin nunu aw lahat tam ningin nut sa magtukak ba?
Yes.
Thank you, everyone. We're going to end the live broadcast portion of our news conference. We're going to be doing another one on Tuesday at 11 o'clock. And once again, next Thursday at 11 o'clock. And these will be regularly, weekly updates until further notice.
Ayun na may kay may sulim mataman na usaktit sinuyok hiya kanila amigo nagkat jawle kimi ila pa mi amalusit amang mila pa mi pinasa ako si ulak tami.